nurse tonight. We just got your vitals, so if you don't mind, we're just going to do a quick 10 to 15 minute nursing assessment.
Awesome.
I'm just going to wash my hands, pull your curtain for privacy, and we're going to get started. Can I see your bracelet? Can you verify your name and date of birth for me?
Michael Spillers.
Very good.
1985.
Very good. And do you know the time and date?
It is like 4:30 on a Wednesday, the 22nd,
Very good. And do you know where you are right now?
in the hospital.
Very good. So you're learn oriented ×3. You're dressed appropriately for the weather. Hygiene looks good. Face and ears, nose are symmetrical. I'm going to assess your scalp. No lesions. Okay, so we're going to check your cranial nerves, starting with cranial nerve number 7. Can you raise your eyebrows for me? Very good. Can you puff your cheeks out? Very good. Can you smile with your teeth? And then touch your tongue on each side of your mouth. Very good. And cranial nerve number 5. Can you close your eyes for me and let me know if you hear, or let me know where you feel me touch?
My left cheek, my forehead, my right cheek, my chin.
Very good. Cranial nerves 3, 4, and 6. Do you have any problem with your vision? Double vision, halo vision, blurred vision?
No.
Okay, can you follow my finger for me? Very good. Let's check your pupils. Very good. Pupils are round, equal, reactive delay, and accommodation. Cranial nerve number 2. We're going to check your peripheral vision, so put your hand over one eye and let me know when you see my fingers.
There they are. I see them. Hey now, there they go.
Okay, other side, same thing. Let me know when you see my
I
fingers.
see them. There they go. Hey now.
Very good. Cranial nerve number 8. We're going to check your ears. So, do you have any problems with your sense of hearing? No redness, discharge, excess cerebrum. Same thing with the other side. Okay, cranial nerve number 2. We're going to check your sense of smell. So if you can lean back so I can look inside your nose. No redness, discharge. Can you cover one nostril for me and breathe in? Very good. Cover the other nostril and breathe in. Very good. Okay. Cranial nerves 9, 10, and 12. Can you open your mouth and say "ah" for me? Your tonsils look good, nice and pink. Your uvula moves with phonation. Very good. Can you stick your tongue out and from side to side? Very good. And then can you swallow for me? Very good. And then cranial nerve number 11. Can you shrug your shoulders for me? Very good. And then push my hand away from your cheek. Very good. Very good. Okay. Next we're going to check your lymph nodes. So I'm going to start with the submental, submandibular, pre-auricular, post-auricular, occipital, and anterior cervical, posterior cervical, supraclavicular, and okay, then we're going to go on to check your pulses. So we're going to start with your carotid one at a time. Very good. Your brachial, if you could straighten your arms out for me. Very good. Your radial. Very good. And your popliteal. Very good. Your dorsalis pedis. Very good. And your posterior tibial. Very good. Okay, we're going to assess your range of motion. If you could just look up for me, look down for me, and then Look side to side. And touch your shoulder to your ear when you do that. Sorry. Touch your shoulder to your ear on both sides. Very good. Lift your arms straight out in front of you. Lift your arms back behind you. Lift your arms up. And then hold your arms out and move your wrists for me. Straighten your legs out and move your ankles for me. Very good. And then lift your hips up off the bed for me. Very good. Okay, now we're going to listen to your lungs. So what I'm going to do is put my stethoscope on your chest, and we're going to listen for a full inspiration and expiration. Every time you feel my stethoscope move, I need you to breathe in and breathe out. Breathe in, breathe out. Okay, and then can you turn around for me? We're going to listen to your lungs in the back. Same thing, breathe in, breathe out when you feel my stethoscope move. Breathe in, breathe out. Spine looks straight. Okay. Okay, breathing is medium depth. AP to lateral is 1 to 2, which is normal. When I say every time, starting when I put my hands on your back, and then every time I move them, I just need you to say 99.
99.
Very good?
99.
Very good.
99.
Okay, we're going to check your thoracic expansion. So I just need you to take a deep breath in and then out. Okay, very good. And then we're going to percuss your kidney. Very good. I think that's good. Skin looks good. We're going to listen to your heart sounds. We're going to start in the second intercostal space, right sternal border, which is the aortic. We're going to listen to the second intercostal space, left sternal border, which is the pulmonic. We're going to listen to the third intercostal space, left sternal border, which is Erb's point. And we're going to listen to the fourth intercostal space, left sternal border, tricuspid. And then we're going to listen to the fifth intercostal space, midclavicular line, which is mitral valve. Okay, your heart sounds good. Now we're going to assess your reflexes. Your muscle firmness feels good on your arms and your legs. Okay, let me check your capillary refill. Less than 3, which is good. Less than 3, which is good. Okay, we're going to check your tricep reflex. Oops. So just relax your arm for me. Very good. We're going to check your brachial. Just relax. Keep your arm loose for me. Keep your arms loose. Brachial. Okay. And then your brachial radialis. Okay. Same thing. We're going to check your tricep reflex. Very good. Your brachial reflex. And then, brachial, and then brachial radialis. Then we're going to check your patellar reflex. And then your Achilles, posterior Achilles. Very good. And then we we're gonna assess your abdomen. If you could just lay on your back for me. Okay. Stomach looks flat and even. Breathing is normal. We're gonna start auscultating your bowel sounds in the right lower quadrant. Okay. Do you have any problems with your bowel or bladder? When's the last time you had a bowel movement? Okay, I'm just gonna palpate your bowels. Very good. And then, okay, let's check your, I think we're actually laying on it. Let's check your plantar reflex. Okay, very good. Okay, let's check your, I'm gonna push your feet up, very good. Okay, push my hands forward, good. And then push my hands back, very good. No edema in your legs, that's good. And then I'm gonna help you get into a comfortable position. And trying to think if there's anything else that I need to do. I said your skin looks good. Okay, the only other thing I missed when we were doing the lymph nodes was the tonsillar lymph node. Okay, and none of the lymph nodes felt any types of lumps or masses. Everything felt good. Okay, so if you need anything, just use your call light and call me.
Awesome. Thank you so much.
We're done.